The idea behind the Men's Health Center is really to match the efforts of the women's health movement. We know that in general, men don't like to see doctors, and we're a little bit behind in getting our health care compared to women. So having a Men's Health Center or men's health program, we have dedicated specialists that's really there to address their reproductive health needs and also hopefully help them age better. Some of the conditions that we focus on are male fertility, erectile dysfunction, testosterone deficiency, and Peyronie's disease. These are all diseases that affect a man's reproductive health and specifically sexual health, and they're important for not just their fertility desires, but also important for their overall health.
I have a clinical and research interest in testicular cancer, also known as germ cell tumors. In the clinic, really excited that we see all new patients with newly diagnosed germ cell tumors in a multidisciplinary context with a medical oncologist, a urologic oncologist. We make sure that all of the diagnostics, the staging, the imaging is state-of-the-art, up-to-date, and help make treatment decisions that are gold standard, state-of-the-art, and importantly take into account the patient's hopes and desires.
I'm a urologic medical oncologist, meaning that a cancer specialist whose focus is on diseases of the urinary tract, which is primarily prostate cancer, testicular cancer, bladder cancer, and kidney cancer. My particular interest in the past 20-some years is in germ cell tumors of the testis. So I've been involved in a big trial run by the SWOG organization, which is just about to finish accrual, which is looking at a new biomarker called microRNA 371, which we hope is going to change the way we treat this disease and hopefully allow us to better target which patients need which treatments and avoid overtreating patients who don't need it.
One of the main interventions in patients with testis cancer is a retroperitoneal lymph node dissection, otherwise known as an RPLND. And we review all the cases together, and in appropriately selected patients, we are able to offer minimally invasive robotic approaches where we can still stick to the principles of open surgery, make sure we're providing the absolute indicated operation, but helping patients get in and out of the hospital a little bit more efficiently and back to work, back to their daily lives in a shorter time frame.
My clinical areas of expertise primarily deal with male sexual dysfunction and oncofertility. This primarily deals with the assessment and management of various conditions such as low sexual desire, erectile dysfunction, Peyronie's disease, and men trying to conceive male infertility. Despite kind of the rise in cancer incidence, there's a growing number of cancer survivors due to early detection and better treatments. This idea of cancer survivorship, the goal really is to maintain and enhance wellness for cancer survivors and really kind of deal with a lot of the long-term complications that are related to their initial diagnosis as well as a lot of the treatments. Our goal really here at the Men's Health Center is to create a welcoming, inclusive environment and space for patients to come and talk about these issues and really address them head on.
One of the things that we really try to do are provide educational opportunities, support groups, advocacy for our patients. We're thrilled to partner with the Testis Cancer Awareness Foundation to host a patient and caregiver facing summit here in San Diego in the fall, just so people can develop a community, understand that it's normal, it's part of the process to be adjusting to a major cancer diagnosis, and that we're going to be okay when this is all said and done.
Hi, my name is Kim Jones. I am the founder and CEO of Testicular Cancer Awareness Foundation. I started this organization in 2009 after my son was successfully treated with late-stage testicular cancer at the early age of 13. I started Testicular Cancer Awareness Foundation in 2009, knowing that through our journey we can help make a difference in the fight against this disease. There was a lack of awareness and education about this disease. My son had a sports physical 8 weeks prior to his late-stage diagnosis, and they didn't catch it in time. Unfortunately, my son relapsed after being cancer-free for 7 years and passed away in 2016. Through my son's journey, we are making a difference in the fight against this disease and saving lives. We are most grateful to UC San Diego Health for hosting our Testicular Cancer Conference. We host these testicular cancer conferences for patients, survivors, caregivers, and for the TC community to provide a safe space for them to share their experience and to learn more about, long-term survivorship and just having that close connection with other people that have gone through the disease.